Whipples disease. Let's talk about it. It's not the problem of only GIT if it is Whipples. Whipples is a multi-visceral systemic condition is what you have to basically appreciate. It is the Trophorema whippli, which is the causative organism. How do you like to call it? It's a gram-positive actinomycete is what need to be remembered. The patients of Whipples will have lymphadenopathy. Why lymphadenopathy? Can you please punch? Online, is the voice clear and loud enough? That helps me to reassure. Is the voice loud and clear enough? Please ask our other students of FMG to come into online MBBS. Yeah. Typically, the organism-laden macrophages, they typically accumulate within the small intestinal lamina propria and the mesenteric lymph nodes, and they lead to the development of lymphatic obstruction. So that is the reason we find lymphadenopathy as one of the important features of Whipples disease. So this is a classical example of what we are talking, Trophorema whippli, which is seen in the macrophages in the parenchyma in a PAS positive stain is what you are able to see. This is another example where you are able to see Trophorema whippli in the macrophages of the parenchyma in the silver stain. Now, doctor, why lymphadenopathy lead to the development of malabsorption in Whipples? First, why lymphadenopathy you understood, then why lead to malabsorption? Basically, that lymphadenopathy will lead to the obstruction of the lymphatic drainage. After all, triglycerides, everything, how are they being transported, doctor? Through lymphatic output only, no? So, that lead to a malabsorptive diarrhea which will occur because of that impaired lymphatic transport is what I want to underscore to all of you. Now, doctor, if I ask you a question, what is that pathological, histopathological hallmark of Whipples disease? Distended foamy macrophages in the lamina propria of the small intestine are considered to be the histopathological hallmark. And how are the macrophages, doc? They contain PAS positive diastase resistant granules. And why these granules are formed? Because of the lysosomes which are stuffed with partially digested Trophorema whippli will typically lead to the formation of those PAS positive diastase resistant granules, which are a very important part to diagnose. If you look through electron microscopy, then you can appreciate those Trophorema whippli, which are the rod shaped bacilli. Now, what is a very close differential diagnosis which also can lead to development of malabsorption to the Whipples disease? Intestinal tuberculosis. So, how do you differentiate Whipples from that of the intestinal tuberculosis is a very important question. If you take that infiltrate of foamy macrophages, it is a feature of both. If you say PAS positive organisms, both the AFB, acid fast bacillus mycobacterium and Trophorema, both of them. But if you take acid fast stain, it is only true for mycobacterium, not the Trophorema whippli, is what you need to remember. Now, if you look endoscopically, how will that mucosa in Whipples disease look like? It's called the shaggy gross appearance, is a classical description. And why does it happen? The villi typically undergo an expansion because of the dense macrophage infiltrate, which lead to that shaggy borders, is a very, very classical feature. Similarly, if you do endoscopy, tomorrow as a gastroenterologist, day in and day out, if I have to catch the diagnosis of the Whipples. See, malabsorption syndromes are very difficult. and very beneficial, very helpful for the patient. If you correctly make diagnosis, whether it is colon cancer or irritable bowel syndrome or diverticulitis or Whipples or tropical sprue, treatment is there, no? So that is always a great benefit. So that way gastroenterologist guys get a lot of applause every day. So because if you make diagnosis, patient is always happy. All emaciated guy once more improves. So that's the reason malabsorption disorders are very interesting to diagnose and also to treat. Then there will be yellow mucosal plaques if you see on the endoscopy. Why, doctor? Because of that lymphatic dilatation and mucosal lipid deposition, typically you will find a lot of yellow mucosal plaques, is what you need to remember. Then there can be the bacteria-laden macrophages not only in intestine. We said multivisceral, no? Problem is, it can also deposit in mesenteric lymph nodes, in the synovial membranes of the affected joints, cardiac valves, even in the brain. Any of the locations there can be deposition in the case of the Whipples. That's the reason a neurologist may end up in giving a clue to you that this is possibly the Whipples disease, is what need to be remembered. Now this is an example of the Whipples disease, which is showing the macrophages in the small intestine. We said no, macrophage infiltrates will be there. These are the PAS positive macrophages in the small intestine, typical of the Whipples disease, is what you need to remember. Now comes what Prashant is proposing. Whipples disease triad, one of the common questions in the exam. Diarrhea, weight loss, malabsorption. These three are called Whipples triad. And what are the extraintestinal features of the Whipples, doctor? Remember, unfortunately, malabsorption may not be there in the patient. Patient may not have malabsorption at all, but he may end up with a orthopedic surgeon because of the arthralgias, with a general medicine guy because of the fever of unknown origin, and lymphadenopathy. Lot of people evaluated whether it is TB. Then he may go due to the seizures to a neurologist, or he may end up due to a valvular heart disease with a cardiologist. Oh, doctor, getting Whipples is no joke. Reading Whipples is easy job, but to diagnose one Whipples means, at least during your post-graduation MD, then I can say that you have done a very good differential diagnosis. Lot of times Whipples disease is a common case for the clinico-pathological conference.